Back to school time can mean an uptick in common infections for young people, and the nurse practitioners at CVS Minute Clinic say that is certainly the case this year. Here's this week's What's Going Around report. In North San Diego, Trina Costa-Teson in Escondido says bacterial pinkeye is making the rounds. This infection usually affects just one eye, but it can affect both. Symptoms include red, irritated eyes, a thick secretion, and eye pain. Because the infection is contagious, it can easily spread in a classroom environment. Treatment includes antibiotic eye drops or antibiotic ointment. In South San Diego, another infection common in young people, especially during hot weather. Kasia Lalakata in Chula Vista has seen teenage patients with Tinea variccolor. This is an overgrowth of yeast on the skin, and the symptoms include patches of skin that appear lighter or darker, a rash on the back, trunk, and shoulders. Treatment includes antifungal creams, shampoos, or lotions. It may take weeks or even months for that discoloration to clear. Another skin infection in East San Diego. Amy Polizzi in Santee has seen cases of molluscum contagiosum. This is a fairly common viral skin infection in children and young adults, and it is spread through contact. Symptoms include small round bumps and an indent in the center of the bumps, as well as itching. Treatment includes prescription creams, sometimes cryotherapy and laser removal to get rid of the bumps. And in Central San Diego, ear problems. Lori Glicklich in Mission Valley has seen patients with perforated eardrums, often the result of rapid changes in pressure that happens when traveling by air. Symptoms include a sharp ear pain, drainage, hearing loss, dizziness, and ringing in the ears. The good news is the rupture usually heals on its own in a few weeks. And that's it for this week's What's Going Around.